especially from 1996 to 1998, and he is the recipient of Prime Minister's Gold Medal for Surgical Excellence. He is trained in Mumbai at Indian Hospital. Also, he was trained at Clyde Institute of Surgery in USA. He developed the original technique of dynamic fracture for the hand fractures, and it became very popular because it avoided surgery.
Dr. Vijay Gawande has changed all that. The head of the Department of Orthopedics in Mahatma Gandhi Memorial Hospital, Bombay, he has improvised his own technique of setting broken bones in the hand without surgery.
This was the sort of technique which just came in my mind in 1986. Since 1986, that's now almost 8 years, I have not fixed up a single fracture with operation. I got very good results with this technique. It's a very simple technique and can be used at any place, including the smallest center in India, like primary health center, in your clinic, outpatient, anywhere. Very simple and cheap, because we make this a very cheap material, like safety pin, rubber bands, and aluminum springs. They are very cheap. And plaster is available everywhere. Bandages are available everywhere.
By creating a cost-effective technique that is non-operative, gives quick results, and is simple enough to be performed by paramedics, Dr. Gawande has definitely made a name for himself in the medical profession.
How did you feel when you invented this technique? Did it make you feel like God? How did you feel?
Really, I didn't feel much about it, because I don't feel it's an invention. It's a discovery. Because I feel you can never really invent anything in this universe. Okay. Everything is existing here. Okay. You only explore, you only discover. But I am very happy when I discovered this technique, because one very important thing is that it's going to save millions of hands from undergoing surgery.
He conquered mastery in fine arts, abstract painting, and played musical instrumental music on an ordinary keyboard. Some of the cases of Dr. Vijay Gawande when taking rounds in the Indian Hospital in Mumbai, this is how he developed a dynamic fracture spleen with many other fracture system to break hand injuries. In today also he tells that he never invented any action system for hand fractures. He just rediscovered them.
Medical profession I don't consider as a business. It's a profession. I feel that creativity is very important in your life, and something which you give to others which will be beneficial to all of us. That's very important. So that I will try to see that something is given to the world. When I die, I must contribute something before I die.
While he told that one must contribute to this world something that someone will be happy and many of us will remember us. Without a simple program of a humble human being, an artist, music composer, painter, and a great surgeon. Currently he is based in Dubai and practices in Dubai. So Dr. Gawande wanted to become an artist or a painter, and he became a hand surgeon. And
this doctor, whose name will be among the who's who of the profession, medicine was definitely not in his list of priorities in his younger years.
Actually, when I was a child, my first desire was to become an artist, painter. Yeah. Because I was the only son in the family, and then my parents, they didn't want me to go to Bombay, because those days I was studying in Wardha, near Sevagram. So I had to go for, what they wanted me to become, like, doctors. My mother wanted me to become a doctor, so I became a doctor. But my first interest in life was to become an artist, painter. When I was a medical student in 1963-64, those days I used to play bongo, drums, and I used to conduct the orchestra in those days.
Ever given a chance, would you give up your medical profession and go back to painting and composing music full time?
No, because medicine is my career, surgery is my career. I am a surgeon, so I will never leave that career. Even if I retire, after my retirement, I will keep doing my medicine or surgical practice. But I will continue to paint also, I will continue to compose music also.
A surgeon, a painter, a musician. This multifaceted gentleman then definitely has a lot to offer. But the question is, what has been the motto in his life which has driven him to achieve so much?
Supposing you were given the chance to relive your whole life again. Relive your whole life again.
Fine.
According to your own choices, what would you choose?
I will do again something which will contribute to this universe from my side. Anything which will be contributory.
Today also, he also had his other extracurricular field of the body. His famous painting of Kriya was offered a blank check by January 1994, and began some of his paintings which are given for recognition across the world.
Dr. Gawande has come all the way from Dubai for this function. And you're an artist, and if you have to redesign the hand, how would you do it?
Redesign the hand?
Yes, because of your artistic abilities.
Try to give maximum support for his motor power, sensations, and the skills to perform all the actions with the hand.